Devi Sundar. She's the founder of Tele-Therapies. She's more a clinician, educator, researcher, and author. So that's a big list against her name, I guess. And she's the founder of Tele-Therapies, which involves around pulmonary rehabilitation and mental health. And I loved her mission, actually, which is written, and you can go and check on the website. Her mission is to empower people on connections between mind and body to enable their management of their respiratory and mental health disorders for improved quality of life. I think that's really, really lovely, isn't it? Somebody doing such a work for the community. Also, I would like to, she's got a big list, so it was really tough for me to crisp it down, I guess. I just want to add, before I pass it on to Devi, is that she's a member of British Respiratory Society, European Respiratory Society, British Counselling and Psychotherapy, British Lifestyle Medicine and Society of Occupational Medicine. It was difficult for me to remember all of this by heart, so I thought it's better I just look at it and share it. So, yes, please join me in welcoming Devi Sundar.
I think I'll be better without the mic.
Yeah,
Because it makes me feel more anxious holding a mic.
Yeah.
Okay. So I feel very comfortable in this group to first of all acknowledge that, because everyone seems to be very welcoming. And by the time I stepped into this main door there, I felt really welcoming, as if like Mr. Pramil welcomed me, and quite a few of you welcomed me as if like I've been a member for a long time here. So.
What's on your decision?
No, it's okay. Just that.
Okay, and also I'm comfortable to talk without the mic. If anyone can't hear, I can go back to the mic. So everyone's fine. Okay, great. And I also like to take this moment to thank the opportunity. Initially, Dr. Shantha Nair, so she was actually approaching me like, would you be able to have a talk today? And I'm more happy to have the community, so I was delighted with the opportunity. And so the health topic is, as my BD has actually kindly introduced me, although like the long list there is not about the pride, but I actually own up all I achieved is because of my friends and family and so far in my life. So I'm more into contributing some health empowerment sessions, okay? And I would hope so that this is not my last session here. Okay, I'm more happy to help and like a labeled committee member.
I've already spoken with Debbie to say if she would be willing to in future. For example, we always have yes.
Yeah, thank you very much. So I'm just not going to be very formal and professional. It's going to be a very informal talk. I'm really giving some empowerment sessions, like informal awareness about lung and mental health today. So how many of you felt breathless when you walked up close to the stove today? None of you. Okay? And you felt it. Okay, thanks for acknowledging.
From where to where? Up the hill.
Depends what sort of mental state you're in when you're trying to do anything.
You
either have
you meant Gloucester to Churchtown.
No, I think sometimes when you're just rushing, although it might not be a long walk, you end up being breathless.
Yeah, okay. But that doesn't label a person having a lung condition. So everyone at one point in life, or sometimes during the day or during the week, we get breathless, okay? And doesn't mean that we have lung disorder or mental health disorder. It's normally our body is able to hold the threshold of anxiety. When we get brushed up, our body is full of chemicals. Okay, so we have to balance this chemistry inside our body, and that actually is activated by, like the wiring in this room for the lights. Our mental function is activated by the balance of our nervous system inside our body. Okay, by the time you put the switch on the wall, the light bulb actually glows up. Okay, that's because of the fastest communication from the cable to that bulb. Our mind, only if it is very clear, it can send some calm signals and clarity. If our mind is more of rush, it is not going to help us to be calm and empowered. Why our mind need to be, our mind and brain is two different things. Okay, so we all actually confuse sometimes the mind and brain is one unit. Our mind is something which is internally, the amygdala is a structure inside our brain, and the hippocampus, it's like a CPU unit for the computer. amygdala is the emotion center, and the hippocampus is the CPU. Okay? Whenever our emotions, universally, research has proved that there's a common 7 emotions: happiness, sadness, anger, fear, and 2 more like shame or guilt, and the moment of loss. Okay, so those are the 7 emotions what universally every human actually experience in their life journey. Okay? And these memories are related to some emotional expressions, how the person expresses by their body, by their tone of voice, how they communicate with the body language. For instance, some people might be very much anxious when coming and talking somewhere, public speaking. This is called a social anxiety. And some people, even for a small group, have the anxiety. And some people might be introvert, extrovert, or ambivalent. So it's all of the personalities, which we call as personality disorder, some people have, like be a cause of the anxiety movements or panic movements approaching a group. So why I'm all linking all these mental things is, only if your mind is clear, the mind sends the signals to the nervous system, and that activates the lung center. Okay, our lung center is basically present in the back of our brain, lower part of the hindbrain, that is the cerebellum and pons, where the respiratory centers are. And that is going to communicate, the cables are coming down from there to our lungs. And the lung is two bags, one on each side of our brain, within our chest cavity, chest wall. And that is actually supported by the diaphragm. And if I ask you, everyone, like most people might be knowing this or not, which is our inspiratory muscle, how we actually inspire.
Inspire.
Yeah, so for breathing, everyone knows we have to breathe in and breathe out. As our traditional Asian practices, we know yoga, yeah, which we are very familiar with. We breathe in through the nose and breathe out through the mouth, or breathe out through the nose, whatever it is, but use with some technique of pause and hold. So what is the main muscle which helps us to breathe?
Is it the diaphragm?
Diaphragm. Yeah, so that is the main muscle that helps us to breathe. And that is where the cables are connected. Okay, so and only if your diaphragm is moving down, your lung is going to expand, and your oxygen, which is the main purpose for our breathing in, is going to go inside. Along with oxygen, we also have a little percentage of nitric oxide going in, which is very much important for our lung. Inside the lungs, there are small pockets which stores the oxygen that is going to open up more. And that is going to help us to keep that small pockets to open up, not to collapse. It's not mainly the oxygen. Like in the community, we all have some good people, some kind of arrogant people. Sometimes we need some arrogancy to have the good things to be done. Okay, so just to put it that way. Okay, so that is what is the oxygen and a little bit of nitric oxide is there in our thing. And mainly we are breathing out to get rid of all the carbon dioxide. But if you're getting rid of all the carbon dioxide, which is we all consider as a bad gas, is not going to be helpful. You're not going to be alive. You'll be more breathless, because that is this is oxygen toxicity which I'm talking about. Okay, so when you breathe in more of, for example, when I asked the question of anyone breathless, if Mr. Patel have been breathless for a longer time, he's breathing in more of oxygen. Yes, the oxygen is a good gas, but why is still he breathing breathless? Because he is expelling all the carbon dioxide out. And that's not helpful for his lungs to function and the balance of it. So we have to have a good balance of, that is like the good and the evil to a balance. Okay, so we have to have the carbon dioxide and the oxygen to be balanced. For that, our mind should be clear. So when you're activating your sympathetic system, which is the anxiety, when you get anxious, our sympathetic system is getting activated more frequently. And that is going to, sympathetic action is all to constrict. Okay, so that is not going to help your mind to be relaxed. So then you're going to be having this difficulty of balance. So that's why we have to activate the parasympathetic nervous system, which is called as the calm and digest nervous system. And once we activate the calm and digest nervous system, our diaphragm is functioning in a normal, both sympathetic and parasympathetic activated. It's a dune-shaped muscle, flattens down, and then relaxes back to this normal position. Yeah? So why I'm actually going to talk about lung and mental health is we all experienced during the COVID time pandemic this breathless episode, this anxiety, this depression, and more so the fatigue, that is tiredness, body tiredness. We all have been through the COVID, post-COVID stint as well, yeah? Which is more of that fatigueness in our body. I'm not able to function or be motivated to function as much as before because your system has been acknowledged to this new normal of being tired, being less motivated, being feeling isolated within your own small family circle rather than as a social animal, we as a human, we are being more can thrive on connecting with people. Yeah? And that connection has been stopped during the COVID. Everyone, yes, we have found a new way as genius minds we are to connect online, but that doesn't actually fulfill or fill the gap of being in a physical presence of people, community. So why I talk all about this is I've been more practicing in pulmonary rehabilitation for a long time, previously in Dublin and then I moved to the NHS England, and where I more focused on people with chronic respiratory disease. And chronic respiratory disease means COPD and asthma. More familiar people are with asthma because you can see people having that blue inhaler around the cough and just getting breathless, having the cough to get back as a quick temporary relief. And I also more specialized in pulmonary fibrosis and bronchiectasis. So why I'm mentioning these labels is we should be familiar with these labels because either one of ourselves or a family members or a friend or someone in the community might be telling you, I had went to the GP for fibrosis, which is less familiar among the people. And I went to the GP to see today for my most of the people are not familiar with COPD, and I ask, what is COPD? Okay, especially in our Asian community. If I say this label to anyone outside in a white people group, they might be able to very quickly, oh, okay, fine, I'll no consciousness, okay? So most people might be, or some people still there illiterate to this particular labels. And if knowing the label is very important so that you can signpost the people to right people to get that support at the right time. Okay? And it's like similar to you cannot bake a cake without knowing the recipes, ingredients, recipes, and labels. So in this group of people, the narrowing of their airways, normally when you're breathless, a person who's healthy, who's breathless, he can actually regain his breath back within a minute. Yeah? But people with chronic respiratory disease are not able to regain even after 3 minutes. Okay, they will struggle. They have to actually know all the techniques and also get the support from their medications, what they've been prescribed. I'm talking about the inhaler regimen or the oxygen, what they're dependent about, and how they're actually proceeding their mind condition, which is going to heal their body and situation, and going to also prolong their recovery status for their breath from the breathlessness. So there are a lot of actually COPD people who are directed to pulmonary rehabilitation. Anyone know about pulmonary rehabilitation here? Anyone heard about what is pulmonary rehabilitation? No. Okay, so pulmonary is lung. Okay? So rehabilitation, as the word explains, rehabilitation. So rehabilitation is a biopsychosocial model. Yeah? Your physical deformity and your emotional mind is connected to physical deformity, so you are putting into an emotional disorder, falling in that trap, and also you are isolating from the society. So it is a group which connects them to the society. So it's called biopsychosocial model. Yeah, and I'm more actually interested to open up a community here to educate people about this because there is, especially in the Asian group. We are more culturally having a good practices like yoga, pranayama, kapalabhati and other things, but how many of them practice? How many of them even think about in this busy world, we only look for the quick solutions, yeah? If you're breathless, get that pill, okay, or the inhaler, yeah? Just get off, and we have so many other things. Watch, scroll down the social media and book holiday tickets for different places, but we don't actually look after or listen to our own body. That means that transpires that we are not respecting our body. Yeah. So God helps one who helps themselves. Yeah. We have in our Asian practices, we go to temple, we go to a lot of rituals, and we do. But in that hastiness, do we also listen to our body and mind? Yeah. So how many of you have a routine of waking up in the morning, sitting up in the bed, and then just closing your eyes for 10 minutes and listening to your body?
We do a little exercise, but not just lying down and doing nothing.
Yeah, 10 minutes.
Yeah,
Rather than
do
just
that,
waking
yeah.
up, scrolling on the phone, or waking up, going to your kitchen and making something for someone or to yourself. You do it. Yeah. Fantastic. And you do it. Yeah, fantastic. That's really good because your body is actually in the rest state and lying down, but while you're lying down, and when we call so-called sleep, not many of us have a good sleep either, we are broken, but the sleep-wake cycle is also in the metabolic activity. At the same time, sleep also has some traumatic dreams sometimes, or memories, or anxiety in sleep. You worry about what's going to be your tomorrow's meeting, what you're going to talk to your manager tomorrow, what you're going to produce tomorrow. Yeah, it's all about tomorrow rather than on the present moment, even in the sleep. So, human being, the label being, is in the present moment. But are we actually living by the word human being? We are all labeled human being. We are not labeled as a dog or cat, but we are labeled as human being. Yeah? So we have to actually respect our body by actually giving the 10 minutes, and that's going to make a huge difference in your day. Yeah? I'm not saying that 10 minutes is going to just get away and you're going to be like a very happy person in the whole world. No, I'm not giving that promise. Okay? But you can able to manage. We all know Hanuman. Yeah? He's the god of resilience. Yeah? It'll give that resilience to us throughout the day. That 10 minutes makes a difference. Yeah? So, going back to this particular chronic condition and mental health, as I already explained about the nerve cables and other things that activate, a diaphragm, I asked about the important muscle, the diaphragm. In people normally, even in healthy people without lung condition, the mental health disorder is going to restrict the diaphragm movements. And that's the reason you're getting more practice. Okay? There is a difference between anxiety and panic. Okay, so people do get panic and breathless. People don't get mostly breathless when they're anxious. Okay, that's the major difference. So anxiety is about the worry about tomorrow. Being restless is not breathlessness. Yeah? And panic attacks is about you totally feel that there is a disaster. Your mind actually fakely imagines there is a danger. And as a human, we have evolved from our ancestor, and we all know our evolution from the ape and then the human transpired. And we still but have that ape mind inside us where we actually look for danger. Yeah? Our ancestors have the real danger. Either an animal is going to attack or another person is going to attack them. Okay? But in our world, modern world, our dangers are all, is the next person getting that Audi? And can I get BMW? Okay? So as the next door son is going for a doctor, can my son go for a lawyer or a consultant? Yeah? So these are all the danger what we actually perceive, and we get anxious, worry about things, and rather than getting in the present moment. And what is that happening is, it's very important to note, whenever you get anxious or worry, your sympathetic system is triggered. When the sympathetic nervous system is triggered, cortisol, stress hormones are released. And from the hypothalamic adrenal center. Yeah? And that is the biggest danger because it actually fakes there is a danger and really dysregulates our immune system. You're all familiar with our immune system, right? So it is a protective mechanism. When anything attacks, any foreign body attacks, and it protects us. Okay? But that is not happening. We are actually really imagining for that to happen, for protection what happens is normally inflammatory response triggers. Yeah? When the inflammatory response is triggered, the body attacks then the foreign body, the phagocytes and everything. I'm not going to go scientifically, okay? So some cells are released and that is going to attack. And that's why the inflammatory response needs to be released for attacking another foreign body. But here there is no real danger, but we are anxious, perceiving the danger, and that is dysregulating our immune system. And that is the reason for a lot of cancer, even if the people who are not actually having tobacco issues. And research has been confirmed. And even people who don't drink or don't smoke, you can hear your friend or relative having cancer. If you look and listen to their history, they would have worried a lot. They would have had a lot of anxiety, depression episodes that they suppress and bottle it up. Not actually adapted to any of the mind health practices. Yeah? And so there is a link between the anxiety issue and a lot of immune deficiency disease as well. Okay, I'm not going to go in depth of the research. I don't want to turn into a webinar or a seminar here, but just very informal. So just to give you making aware of it, and I would appreciate if you go out after this session and read about these things, what I taught today. Yeah, I don't want you to believe blindly, because we have this very, very important function of our cortex is the frontal brain. Is like we analyze and problem solve. But mostly what we do is the time pressure, we just go by the word of mouth or the say. We don't actually research the evidence. So I want you to, one good thing you can do, or my ask to you today, is read about anxiety and immunodeficiency and cancer and other illnesses. And I also produce free educational videos in my YouTube channel, Love My Channel, where I've educated these materials as well. So you're more welcome to access that and also get evidences. So recently I published 2 YouTube videos on the importance of mental health in chronic respiratory disease, and that's something with the research evidence as well, so you can actually go and watch that one. So today I'm going to leave you with 3 practices. So if I could ask you all to sit up straight, and to make you aware of your breathing. Yeah. So I want you to put your hand, one hand on your chest, and one hand on your upper belly. Yeah. And now I want you to first of all become aware of how you breathe. Okay. So if you want to, if your preference is closing your eyes, please go ahead with that. And then breathe normally. And feel whether your chest is moving, your tummy is moving. Okay, now open your eyes. So, how many of you have a chest moving up? Okay. And how many of you the tummy moving up? Okay. So
Tummy and chest
when
both
you're
really
breathing in,
move.
your
Yeah.
tummy moves out, and then when you're breathing out, your tummy moves in. Yeah? And for some people who have their breathing only the upper part, is actually not a right way of breathing, because you're stressing your muscles, your oxygen is not going deep down, your diaphragm is not moving down. So normally what happens is, if you could watch myself, actually, when I'm breathing, breathing in, my tummy moves out, okay? And breathing out, tummy moves in, okay? So I use a pursed lip. That's what you're going to do now in a minute, okay? This is a breathing exercise which I want to teach you. So breathe in and breathe out. Breathe in for 2 and breathe out for 3. Okay? Now I want you to become aware of your diaphragmatic breathing. Okay? This is normal breathing. Okay? So diaphragmatic breathing is you're breathing in deeper and then breathing out again deeper. Okay? So your belly button should go back towards your spine as much as it can. Okay? Exhaling all the air out, and then breathing in, your tummy should come out as far as possible. Out. Yeah? So are we all ready? Okay? So breathing in. Breathing out. Again, one more cycle. Breathing in. And breathing out. Now, I want you to pause. Introduce the pause. Okay? So, I'm going to count. I'm not going to perform, and I'm going to watch. And so, breathing in for 2 counts, pause for 3 counts, and breathe out for 6 counts. Okay? So, let's do that. So, everyone ready? And relax your shoulders. Be mindful that you're relaxing your shoulders. Okay? And then breathing in for 2. Ready? Start. 1, 2. Hold for 3. 1, 2, 3. And breathe out for 6. 1, 2, 3, 4, feel now holding? It is a pause. Why you need to hold this? Your gas exchange, what you believe is the oxygen is going in, but it's not getting exchanged immediately. If you're going to breathe out very faster, it's not going to get exchanged.
Yeah.
So after you're breathing out, your oxygen is exchanged between your pockets, air sacs, and your blood vessels, which is going to take that oxygen in. Okay? So it is good to have this practice of pausing when you're practicing exercise. Normally when you're breathing, it's very gifted that we can manage our breathing without our conscious at first. Okay, so we are in that way gifted. But when you're starting to practice this regimen to strengthen and improve your quality of life, strengthen your lung and improve quality of life, it is introducing the pause is very, very important. Now, the second exercise what I want you to teach you is being aware of your movements is very important. I instructed don't shrug your shoulders, okay, because these are all the accessory muscles which support your breathing. Yeah. So if you're going to shrug the shoulders and what am I doing? I'm not actually allowing my ribcage to expand. If my ribcage is not expanding, there is no way my lungs can go to its elastic level, maximum expansion. Yeah. So having this shoulder movements as one part of the exercise is good, and also be mindful of watching your shoulder movements during diaphragmatic breathing is also very important. So now the next exercise, are you ready? Yeah. Okay. So next exercise is if you can take a comfortable straight position and back well supported. And I want you to, we are going to do actions with the arms first, okay? So, I just want to explain, just watch me. So what we're going to do is, we are going to breathe in, as much as each one's lung capacity is different in this room. My lung capacity is not the same as your lung capacity, okay? So we have a little difference, okay? Based on our age and based on our height and also our cultural ethnic group, okay? So we each one have a different lung capacity. So, as much as you're able to breathe in, normally you're going to breathe in, okay? As much as you're able to breathe in, while you're breathing in, I want you to raise your arms. If you're breathing in, stops this way, you have to stop your arm this way. And if you're breathing, you can breathe in more further, you can stop your hand this way. If you're breathing up, breathing in goes up to that level, stop that way. So I'm going to also watch how much is your lung capacity, okay? So there's no competition, but just let's actually check how much we can raise up, okay? So, and then breathe out. Very good. Okay, everyone young and healthy here. Okay, so breathe in. And breathe out. Okay, this is a very simple exercise to activate your chest wall muscles and your shoulder muscles. Sometimes I get that number wrong. Okay. So the humming. Okay, so we all do humming. We all are familiar with our traditional practice of Om. Okay, which is really a very good psychological medicine we can take every day by saying that 10 minutes of waking up and saying Om or this humming thing that I'm going to do. So breathe in and do humming. Great. Okay. People have good lung capacity. So the longer you hum, that is how it indicates your good lung capacity. Yeah? These are 3 simple exercises. We can do one more of humming to just calm down ourselves a bit. So let's start again. Breathe in. And hum. I've just actually given you as a sample exercise. There are many other exercises which you can do to improve your lung function. But these are all the complementary things which could actually, in your own home, as a conservative method, which you can help and respect your body and mind. As I said before, respecting your body and mind. By doing these practices, it will help you to get away from that COVID blues. Okay, still some of you are stuck with the COVID blues of less motivation. frustration, feeling tired, and having that impression of the new normal, I don't able to do much as I was able to do before COVID, okay? That will all be slowly disappearing when you start to into this practice, okay? By doing this practice, you're also improving your chemistry in your body, yeah? And that's going to be very helpful as well for your mind to be in a healthy way, functioning and commanding your lungs to function the right way, yeah? Okay, so that's the final thing. And as a final thing, I would like to pass on this to everyone. From me to you, to think, waking up, doing the 10 minutes of practice and looking at this bookmark and reading these phrases for yourself so that you're feeling powerful. Okay? Which I'm telling you about self-esteem. So everyone, self-esteem is the self-confidence and self-worth. As I said, like this particular bookmark, if you could look at that at 10 minutes in the morning, read it for yourself after the practice of one of the breathing things that we practice, it's going to improve your mental well-being and improve your self-worth and self-confidence. Yeah? Because when you fall down, you like someone to be lifting you up. Yeah? But internally, you're falling down most of the minutes in the day. There is no one beside you to lift you up. Yeah? You need this positive affirmation for yourself, and believing in yourself is the greatest powerful strength one can actually give the respect to oneself. Yeah? So believing in yourself is going to help you to be powerful by yourself rather than comparing yourself to other people. Because why you actually compare with other people when you feel a loss inside you? Yeah? When you feel you don't have much than other people. But if you believe that your self-worth is important and good, and also the person in front of you also has a good self-worth and good, there will be no kind of competitions, jealousies. Competitions is good, healthy competition. I don't actually disagree with that, but unhealthy competitions, I believe so you all know about. Okay, so those kind of gossips and other things, that we can actually get rid of that when we actually start to believe in ourselves and have that kind of higher powerful version of ourselves. Yeah? Because we are all powerful. It's only that we forget that for a second or a minute and then start into this mental trap. And that creates ourselves in a destructive mode. And we look like the Tom and Jerry. We look like a Jerry and someone else looks like a Tom. Yeah? So when we actually think about ourselves, we are not Tom and Jerry. We are all actually equal in the planet. Then we'll be able to survive. Fittest survives. We can win the dog steering. And one more final word I want to add is this diaphragmatic breathing practice, if we could actually really consider, my humble request is because most of us also have this IBS, okay? Acid reflux, abdominal pain, yeah? And constipation, yeah? 10 minutes, research is true, 10 minutes of diaphragmatic breathing helps to improve all those symptoms. The reason because I have spoken about this parasympathetic nervous system a lot now in this last few minutes talk. And that is actually the vagus nerve, which is one of the longest nerve in our body, okay, which runs from the top of our brain center and throughout our leg, okay. The passage is through our diaphragm. So the doom-shaped muscle, it as a whole, through that the vagus nerve passes. So when you do this diaphragmatic breathing, you're gently triggering the vagus nerve to relax, and that's going to send that signal to the abdomen, because the abdomen and the brain is connected, the gut and brain is connected. That will help us to also to relieve those symptoms, which is a barrier for us to be ourselves. Yeah? Okay, thank you for this opportunity.
Thank you very much.
This is not going to be your last talk. I think you have digged your own grave, I would say, so by coming to this session. So I think we are going to be behind you.
You are most welcome. Thank you very much indeed. Thank you.
I think Devi clearly pointed out that I think that the verse from Bhagavad Gita where you are your enemy and you are your friend. So yes, we have learnt the practices or heard the practices, but now it's time to practice it. So lift yourself up. Okay? And now with the first time we take the practice on behalf of Dr. Dr. Shantha Nair for.
Oh yeah, how did you meet Dr. Shantha Nair?
That's her husband.
No. I'm Mr. Shantha.
I'm yet to meet Dr. Shantha.
Ah, there we go.
Not met. Yeah.
You met her secretary.
Yeah. So that will be the first. I've seen you before her. Oh yeah.
I thank her really for this opportunity to meet the community because I always want to contribute to the community. So yeah.
Thank you.
And I'll keep
Thank
my
you.
word. So, yes.
So